Imagine waking up in the middle of the night with your big toe feeling like it's on fire. It's red, swollen, and so painful that even the weight of a bedsheet feels unbearable. Sounds dramatic? It's not, it's gout. Once known as the disease of the kings, thanks to its association with rich food and wine, gout is no relic of history. It's affecting more people than ever before. But what causes it? Why do some people get it while others don't? And is it just about what you eat, or there is more to the story? In this video, we'll break down everything you need to know about gout, what causes it, how to spot it, how it's diagnosed, and most importantly, how it can be treated and prevented. Whether you're a medical professional, a curious learner, or someone dealing with gout yourself, stick around, you might hear something useful. Gout is a relatively common form of arthritis, or joint inflammation. It typically manifests in flares, between which there are periods without symptoms. Over time, repeated flares can cause permanent damage and deformity in the affected joint. It usually affects middle-aged and older men and postmenopausal women, while it is rare in premenopausal women. To really understand gout, we need to zoom in, right down to the molecular level. Gout belongs to a group of diseases known as crystal arthropathies, diseases caused by the deposition of microscopic crystals in the joints. In the case of the gout, the culprit is uric acid. When uric acid levels in the blood become too high, it can crystallize and deposit in the joints. These crystals resemble tiny glass needles, triggering a powerful inflammatory reaction from the immune system, resulting in the classic symptoms of gout. High uric acid doesn't always cause gout, but gout almost always means high uric acid. Uric acid forms when your body breaks down purines, found in certain foods and your own cells. Normally, uric acid dissolves in the blood, goes to the kidneys, and leaves the body in urine. But sometimes your body makes too much of it, from diet, some cancers, and psoriasis. Sometimes the kidneys may not clear uric acid fast enough, especially in kidney disease with certain medications like diuretics, or sometimes just due to genetics or bad luck. Factors that increase the risk of gout include obesity, male gender, certain diseases such as diabetes, heart disease, and kidney disease, as well as the consumption of fructose-containing products like sugary soda and purine-rich food like red meat and seafood. Gout usually begins with a sudden flare of pain in one joint, typically the big toe. Other joints like the ankle, knee, or elbow may also be affected. During the initial flare, usually only one joint is affected. However, as the disease progresses, multiple joints may become affected. You may ask, why the joints? Why the big toe? Well, joints are cooler than the core of the body. There's less fluid movement, so things settle. The big toe gets more stress, especially overnight. It's like crystals forming in the corners of a cave, cold, still places where things can accumulate. A gout flare may occur spontaneously or more often provoked by an injury, surgery, physical and emotional stress, and consumption of large amounts of alcohol or purine-rich food. Each flare begins abruptly without warning. The affected joint becomes swollen, red, warm, and extremely painful, often to the lightest touch. The flare typically begins at night and reaches peak intensity within 24 hours. The symptoms subside gradually over 3 to 14 days, then resolve completely. at least in the early stages of the disease. Over time, a flare may become more frequent, affect multiple joints, and last longer, potentially leading to chronic joint damage. Between flares, individuals may experience symptom-free periods that last from weeks to years. Some individuals also experience systemic symptoms such as fever, fatigue, or general feeling of being unwell. Persistently high uric acid levels can lead to the formation of toffee, painless, hard lumps of uric acid crystals beneath the skin. These often appear near bony prominences like the elbows, ankles, or fingers. In advanced cases, the skin overlaying a tophus may break open, releasing a chalky substance. Uric acid crystals can also deposit in the kidneys, leading to the formation of kidney stones. Between 10 and 40% of people with gout may develop kidney stones at some point. Gout is usually diagnosed by a rheumatologist or primary care physician. The diagnosis is often straightforward when the classic symptoms are present. Blood tests may show elevated uric acid levels, although during an acute flare, uric acid levels can actually be normal or even low. That's because the uric acid is leaving the blood and depositing in the joint, temporarily lowering blood levels. If needed, the doctor may aspirate fluid from the affected joint using a needle. Under a microscope, the presence of needle-shaped uric acid crystals confirms the diagnosis. Joint fluid analysis is especially important to rule out joint infection or other types of crystal arthritis, such as pseudogout. Gout flares are typically treated with anti-inflammatory medications, such as non-steroid anti-inflammatory drugs like ibuprofen, colchicine, or corticosteroids. Most patients experience relief within 72 hours of starting treatment. It is important not to start or change uric acid lowering medications during a flare, as this can worsen the inflammation. However, if you are already taking them, continue. Stopping suddenly can worsen things. Changing uric acid levels during inflammation can destabilize crystals. The long-term goal is to reduce uric acid levels and prevent future flares. This is often achieved through lifestyle changes, including weight loss if overweight, staying well hydrated, meaning at least 2 liters of water per day, also helps. It is also advised to avoid alcoholic and sweetened beverages, especially beers and spirit, and reduce intake of purine-rich foods such as liver, tuna, sardines, seafood, pork, veal, lamb, and turkey. If lifestyle changes do not sufficiently lower uric acid levels, medication may be required. These medicines either decrease the production of uric acid, like allopurinol, or enhance its elimination, like probenecid. This treatment is often lifelong and should be regularly monitored by a healthcare professional. With proper treatment and lifestyle modification, gout can be effectively managed and flares minimized. However, if left untreated, gout flares can result in permanent joint damage, frequent and debilitating flares, toppy formation, kidney stones, and chronic kidney disease. Thank you for watching this video. Have a great day.